Thank you very much. Let me attempt to see if I can share this one the right way. Very good. So hopefully everybody can see me fine. Thank you for the invitation to speak and for the introduction. In Australia, where I am, and it's 4:25 in the morning, we like to begin by acknowledging the traditional owners of the land that we live and work on. The University of Sydney campus, which is pictured here above me, is on Gadigal land, and I'd like to show my respect to elders past and present. So my talk also follows on very nicely from Martin's talk, because I'll also be talking about why we need to access and understand much more information than just the manuscript or published article that sits in front of us. And it really is about the things that we often can't see. So rather than go into detail about the size of the problem of influence in sort of a specific domain or an area of research, I'm going to spend much more time trying to convince you of what I think is a solution for managing the influence of research sponsorship and financial conflicts of interest in more sophisticated ways, and beyond the kinds of retrospective analyses that we're currently limited to in meta-research, where we often discover problems that are well after the harm has already been done. So I don't have any financial conflicts of interest to declare, but I will briefly mention some of the work that has been funded by the National Library of Medicine on an R01 grant that's led by Florence Bourgeois, on which I'm also a co-investigator. We've been working together for around a decade on issues related to financial conflicts of interest and funding. And I thought I'd also make a quick note while we're on this slide. In the area of meta-research, we like to distinguish between funding for research, like the R01 here that funds some of the research that I do, and financial conflicts of interest, which would be money or other financial gain that I would receive personally for being an expert. And I have none of these to give you as an example. So in the rest of my talk today, I'm actually going to refer to both funding and financial conflicts of interest. And we think of these as separate things when we measure them in meta-research. Also of relevance on this slide is that I'm an interim member of the trustee for the Society for Research Synthesis Methodology. I sit on the advisory group for Prospero, and in the past I've been an associate editor for Systematic Reviews. And so my focus is often on things related to evidence synthesis and how we make sense of health evidence, even when the provenance of that evidence may compromise the integrity of what's being reported, as well as how it's being reported. So this morning, I guess it's Friday morning for me. I'm going to try and make the structure of what I want to say very simple. And it's because the argument that I'm going to make is a little bit complicated. We're talking today about the near future as well. So I'm going to start by explaining what we know about the transparency of disclosures. I'm going to explain that even if we had perfect access to disclosures, that readers and people using the evidence still don't really know what to do with them when they encounter a disclosure. In the second part, I'm then going to attempt to explain how we might use accessible data and AI to build tools that can help readers interpret published research based on some of those invisible factors that might influence or distort what we read. Then at the end, I'm probably going to also touch on the need for more funding in this space, not only for more meta-research, but also to fund multidisciplinary research that could lead to new tools and new tech-based ways to mitigate the influence of research agendas on research and its translation into policy and practice. So where does influence happen? Well, I don't really need to spend too much time on this slide, because you've heard and will hear more about examples of where influence happens, from deciding what studies are funded, how they're designed, what gets reported, and then how it's reported. But I thought I'd also like to remind you that sponsor influence also definitely happens in synthesis, in areas like systematic reviews and in guidelines, as well as in what the media produce and what the public consume. One of the earliest studies that my group did, or my team did, back in this space in 2014 was actually looking at Tamiflu. It was actually looking at Tamiflu and Relenza, which became an increasingly controversial drug that was meant to be used for the prevention and treatment of flu. And billions of dollars worth of the drug were being stockpiled based on some quite complicated evidence. Most of the meta-research that was done in this space after was on the release of data and how those data were being analyzed in primary studies. And a lot of that was to do with intention to treat, for example. But my team, we were much more focused on systematic reviews. And what we found, unsurprisingly, was that when systematic reviews had financial conflicts of interest, or if they received funding for their research or for their systematic review from companies that produce Tamiflu or Relenza, they were, of course, more likely to conclude favorably about the use of drugs in broader populations, even when they failed to fully disclose their own funding and conflicts of interest related to the drugs in their reviews. So, unsurprisingly, but also importantly, systematic review authors are also able to manipulate and change the designs of their studies to reach conclusions that are favorable based on their agendas. What I want you to take away from this particular slide is that research agendas can shape every part of the design, reporting, synthesis, and dissemination of health research. I'm going to come back to this in a couple of slides to explain that this means we can't just look at what's reported. We can't just look at the document that sits in front of us to estimate the likelihood that the results or conclusions are missing or distorted, and that we need to look at and connect the full scope of research from start to finish to be able to do this kind of useful meta research. Okay, so I want to go through this one quickly because I'm hoping, and I think Quinn Grundy may want to speak about this in more detail tomorrow. But we spent together, Quinn and I spent a fair amount of time going through both disclosures of conflicts of interest and funding statements for a random sample of articles that were published in journals that were all signed up to the International Committee of Medical Journal Editors, their expectations on disclosures. And what we discovered was that nearly a quarter of published articles disclosed relevant conflicts of interest, and another 14% were missing proper disclosures. The number with disclosures increases to over 30% for drug studies, and importantly also for commentaries of any type. I'll also come back to commentaries and opinions in later slides, but the other thing we found was that published articles that had conflicts of interest, relevant conflicts of interest, were more likely to be published in higher impact journals, and they're also more likely to receive media attention, which suggests that people are disproportionately exposed to research that is at higher risk of presenting biased results, conclusions, and of course, opinions. So influence is hard to catch. Yesterday, Lisa Berra went through in detail the meta research analysis that she worked on with another team in Cochrane, showing that there was a difference in results produced by industry-sponsored studies that favored drugs they investigated. And one of the most important findings of that meta-research was that when we apply our standard tools, these are the kinds of tools that we can just take a paper and measure the risk of bias. So when we apply those standard tools to measure risk of bias in what's published, we don't see a difference in the things that we measure, but the difference in results and conclusions remain. So put simply, there are hidden factors that lead to favorable conclusions in studies that are sponsored by industry. This means that the influence on design and reporting of studies can't be easily identified or quantified using standard tools. We can't just apply standard tools to every study ever and publish that alongside studies for readers to view to sort of help mitigate. And so we've seen a number of approaches for trying to identify and measure influence using meta-research. And something that most of these meta-research studies have in common is that they take a substantial amount of detective work. And we've seen this in examples today already. They take a substantial amount of detective work by experts going through many sources of information, and often sources that are hard to access or take a long time to access. And this means that there's no obvious way that we can investigate the trustworthiness of every single study, every single review, or every single media communication associated with health research. It ends up being just too much work. So disclosures are not enough. And we also heard this earlier today in a talk about the need for a central repository for conflicts of interest that is publicly accessible. And what's on previous slides sort of forms the basis of the key argument that I have related to the management and mitigation of sponsor influence on research, which is that even if we do have perfect disclosure practices, an individual reader of a study or review or a media communication will have no simple way to sort of deal with the disclosure of industry sponsorship or a financial conflict of interest. So for example, if a reader encounters a disclosure on a paper, should they just ignore the study? Should they be more wary of the results and then try to read between the lines? Or alternatively, should they just trust the research even more because they can assume that the authors must be experts if they have access to funding or if they're receiving money from industry because of their expertise? And so we don't really know what to do with a conflict of interest disclosure once we encounter it on the page. And so my argument is that we do need to start with better and more accessible records of sponsorship and financial conflicts of interest among the people who produce and report on research. This is so that we can start to automatically label research protocols, registrations, reports, reviews, media communications with better indicators of how much weight we should give to those results and conclusions, or to indicate that the study is likely to be so compromised that it shouldn't be considered in synthesis at all. So calls for author-centric public records of conflicts of interest go back to at least 2007. And there's an example I've listed here with a DOI by Rubenfeld. It probably is earlier than that as well. And I attempted to make this argument again in 2016 from the perspective of a computer scientist, which I am. And this corresponds to a couple of the solutions that Lisa Barrow discussed yesterday, including open data, as well as methods for accounting for differences. Okay, so let's move on to the second part of the talk. And I'm going to be talking about artificial intelligence, and in particular, modern artificial intelligence or modern machine learning methods that have been sort of released in the last 4 years. And a little aside, if you aren't aware, computer vision and the use of images was transformed through a kind of renaissance in computer vision about 12 years ago now. And that's the reason why these days we're able to, open our phones with our faces, or we can have cars that drive themselves. And the same sort of renaissance happened for text or for language in sort of the last 4 to 5 years. And the effects of this are now being seen in real world applications, less so in health and medical research so far, but they are there. And so you might have already seen the news about the OpenAI chatbot. There's been quite a lot of hype about how it's expected to transform almost everything that we do. The OpenAI chatbot takes advantage of the newest language models, which are trained on huge volumes of data from the internet, as well as using astronomical numbers of parameters, very expensive to build and very expensive to compute. And what they do is they capture the context of language so that, for example, this chatbot can hold an intelligent conversation, as well as do other tasks like classify documents or answer questions. The reason why the OpenAI chatbot has captured the attention of the world so very quickly in the last couple of weeks only is because it's advanced to the point where it's almost mostly indistinguishable from how an expert might respond to a question. And anyone can access it and even build it into their own systems through the use of an application programming interface or an API. And so what it does is it summarizes information about any topic, and it can be convinced to answer questions that might be expected in, say, for example, an undergraduate exam, to come up with new ideas that connect topics, or even to generate the summary page for a grant proposal on almost any topic. Importantly, it can also be convinced to answer questions that a patient or caregiver might ask it about a condition or symptom. And so on this page, I've asked the OpenAI chatbot to summarize the results of a trial for a general audience based on its abstract. And if you can't read the summary quickly, I can tell you that it correctly identifies sitagliptin as a medication and as the key intervention in the trial. It correctly summarizes the results, and it correctly understands what blood sugar levels are in relation to clinically measured outcomes, even though there's no mention of blood sugar anywhere in the abstract. And so you can see here it says, can help control blood sugar and is generally well tolerated. It also says more research is needed to fully understand the effects. But let's look at what happens when I use exactly the same question, but I change it and I ask it to make sitagliptin sound safer and more effective. It then changes, and now it says it can effectively control blood sugar levels, that it is well tolerated with no serious adverse effects reported, and that it may be a safe and effective option for managing type 2 diabetes. And these things, they're all mostly true statements, but the marketing spin here is really obvious when we line those two things up side by side. And so besides the potential to quickly create advertising masquerading as evidence, what I worry about now is that I didn't actually need to give it the abstract to convince the AI to give me a summary of the safety and efficacy of adding a new drug to the regimen for type 2 diabetes. I could have just asked it about it for myself or for someone I care for without giving it the abstract at all. And because of the way these things are built, we aren't able to determine what evidence the AI is drawing on. We can be reasonably sure that it isn't assessing the evidence for bias or reliability. It's not looking at financial conflicts of interest. And it may be assuming that if the majority of studies are favorable, then that must be the truth. This means that in the very near future, it's likely that the kinds of biases that we've been discussing will manifest in new ways that we may not be able to investigate using traditional meta-research methods. So the idea of open data has already been mentioned earlier as well, and transparency is of course useful and important, but it really only helps us to better investigate the impact of sponsor influence using meta-research in retrospective ways. And that's often, as I said, many years after the damage has already been done. And this is because meta-research is extremely time-consuming and requires specialized expertise. Much of the manual labor that we spend our time on comes from connecting and comparing these disparate sources of information about studies and their synthesis. And this is where my team and I have spent most of our efforts. I didn't quite mention before at the start, but my expertise is in computer science, especially in this area called natural language processing, or NLP, which is concerned with making sense of text. And so each of these arrows then represents a place where we might develop NLP methods and tools to automatically extract and compare information to support meta-research studies investigating factors that might indicate biases. These include design factors in protocols or registrations, such as changes in primary outcomes or choice of comparator, things like identifying missing links between registrations and the articles reporting their results, methods for extracting information from those to compare, for example, primary outcomes in a registration, matching primary outcomes in the article. It includes automatically extracting structured summary data from places like clinicaltrials.gov to compare what's reported to detect outcome reporting bias, or ultimately what we'd like to do is to bypass the reporting in articles altogether and synthesize the results directly from structured results data. And finally, it could also include some of what I showed you in the previous slides, but in reverse. So asking whether the resulting summaries that are made for a general audience are fair or biased representations of what is being reported and concluded, or applied to any one of these documents to identify things like design biases or spin. So while AI will definitely make it harder to deal with bias, and there is a real risk that we will soon need to deal with some new problems that we haven't seen before, these are also exactly the same methods, machine learning methods that we're already using to try and make meta-research and robust evidence synthesis easier and faster. And so we can achieve what I proposed before, that is, tools that can estimate the risk of an individual document to be able to flag it as risky, to adjust the weight we give it in synthesis, or to discount it completely. And so this is just a list of the work that we published in the last 3 years. And what I really wanted to make note of here is that this work is it's especially hard to do because it's hard to fund and it's hard to publish. Spotting problems and highlighting what's gone wrong is seen as much more exciting than the development and maintenance of the plumbing that sits underneath the systems of research integrity. So to summarize what I think needs to happen next, I think we need to seriously consider implementing and properly funding 3 things that could have transformative effect on how we make use of evidence and how it's represented in policy practice and in the public domain. First one, we need to finally establish that author-centric open registry for funding and conflicts of interest data, not just restricted to physicians in single countries or held internally within institutions. And these data, they need to be made accessible in computable forms so that we can start to do much larger data-driven meta-research at scale. Second, I think we need to do a better job of standardizing how we analyze biases in meta-research and how we make data and annotations available in forms that can be easily aggregated to perform much larger studies. That's not to say that meta-researchers are bad at sharing data, they're quite good at it, but rather that we could do more. That the analogy here would be the difference between a meta-analysis based on summary measures versus an individual participant data meta-analysis, for example. And so I think if we do both of those things, then we can also do a much better job of the third, which is to build machine learning methods for estimating the likelihood that a registration, a report, or a review article, media communication presents a distorted view, so that we can flag it for further investigation or find ways to reduce its influence on policy and practice. Okay, so I'll end there. And here's just a list of some of the co-authors and contributors that I've worked with on studies of meta-research, as well as some of the machine learning methods that we've developed as well. So thank you for inviting me to present, and thank you for listening.
Thank you. That was absolutely fascinating. I, for one, had not really thought about the potential for implicit bias in an algorithm. And now I have to look and see whether the algorithm is sponsored by somebody like IBM or Cisco, to make sure that there isn't somebody behind the machine that is leading to warpage of our algorithms. Fascinating.